Meaning of group practice.
Group practice.
Group practice.
Group practice.
Group practice. Group practice refers to a healthcare model in which several doctors work together in a shared practice or clinic, often pooling resources and expertise to provide more comprehensive care to patients. This model allows for better coordination of care, improved access to services, and increased efficiency in managing patient populations. Additionally, group practices may be better equipped to negotiate with insurers and other stakeholders, potentially leading to better reimbursement rates and more favorable business outcomes. Overall, group practice represents a promising approach to delivering high-quality, patient-centered healthcare.